When asked what inspired me to do this work, it started really early on in my career. I had a shift where one of our nurses did not show up for work that day. And as the charge nurse at that time, part of my responsibility was clearly to make sure that we had the staffing that we needed. And when she didn't show up, it was a concern for our patients on the unit, and then also, of course, her as our employee, friend, and colleague. And so I worked with HR, worked with the leaders of the hospital, and we ended up calling the police to do a well check on my colleague. And when they got to her apartment, they knocked and nobody answered. They proceeded to go inside and they found that she had a self-inflicted gunshot wound and she had taken her own life. And this was a beautiful, young, driven nurse with so much potential in her late 20s. And I still am fighting back some tears as I talk about her, because I look at people now her age and I think, we just failed her. We failed her on so many levels. We could see she was struggling. She had had a really difficult patient who was young in nature, and about a week or two prior to her taking her own life, had been someone that we'd been working really hard to save, and unfortunately our efforts did not succeed, and he ended up passing. And this particular nurse had been taking care of him for multiple days, had gotten to know his family, and we just had nothing to offer her. You know, we kind of act like we have these shields from our emotions. And of course, when you're working in healthcare and you're seeing life and death and you're seeing trauma and you're seeing tragedy, you do have to learn how to disassociate in some capacity from your own emotions to do what is needed to try and save someone's life. But what we do not do a good enough job at is, once we have seen trauma after trauma after trauma, is pulling that person aside and saying, are you okay? What do you need? What can I do to be there for you? What resources do we have? You should not be alone. How can you take care of yourself? How can we support you? And we did not do that for her. I didn't, my colleagues didn't, our healthcare leaders did not. And she was left alone to struggle with her own grief, her own trauma, and no tools to navigate that. And I will never forget that moment when I found out she'd taken her own life. On top of that tragedy that our entire staff was grappling with, we went to her funeral service in celebration of life and watched her parents trying to make sense of their newly graduated nurse who had all these dreams and aspirations, and they were just gone. They were just gone. Everybody there was taken aback. Nobody had words. Nobody knew what to say. Even the people who say things all the time around life and death were really left speechless. That exact evening, myself and a number of her colleagues and friends went back to the hospital to work, because the work never stops in a hospital. It is 24/7, 365 days a year. We all decided that we were gonna hold each other close and do what we needed to do to get through that shift. And when we arrived, we realized that we were going to struggle for a lot of our own reasons, given the day we had had. We were also left short-staffed. I can honestly tell you, in my 50 years of life, I don't know if I've ever been as insulted as I was at that moment. I was charge nurse on the floor. I took as many patients as I could myself, and the solution that we were given that night when I called HR and said, this is not okay, we need support, we need resources, is about a handful of pizzas delivered to us. And I have never had such a second insulting moment in my life. When we needed a hug, we needed pastoral care, we needed trauma debriefing, we got a pizza. And in healthcare, when you see the things that we see, it is not enough. It does not cut it. And that is exactly what we are trying to solve with all of the different service lines that we are providing. We are trying to give an outlet to our healthcare professionals to take care of themselves, because we know they are experiencing these moments. We are trying to give healthcare leaders an opportunity to really show their staff that they care, that they understand the pain that they're in, that they understand the struggles they're going through, and giving them tangible solutions other than something that actually doesn't promote health, it takes away health. We are looking at how we can show our gratitude in a much more impactful way, because When you're dealing with life and death, and you're holding life and death in your hand every day you show up to work in healthcare, we have to have solutions, we have to have support, we have to have services, we have to have resources that actually get someone through those moments and help them stay in the profession that we all need them to stay in, because you need them and I need them. And as a community, we have to show our support in a much more impactful way than we have to this day.